Hello, my name is Anna Lyons, and I chose to do my project on wireless ultrasound transducers. So, a brief explanation of what that is. Wireless ultrasound transducers are kind of what they sound like. So, they're portable scanning probes, and you can connect them wirelessly. There's a lot of different options when it comes to how you can connect them. You can do a smartphone, a tablet, or computer. This has a benefit as opposed to being attached to a larger ultrasound machine and having multiple cords and the heavier equipment to carry around. Instead, you have a smaller probe that doesn't have any wires attached to it. This makes for easier scanning, more convenient use, easier for the bedside. Over time, it seems like this is going to help a lot more healthcare providers as they can see the patient's images right at the bedside and give that flexibility, especially when scanning in rural areas or in households or in emergency situations. The physics for behind the wireless ultrasound transducers is the same as a regular ultrasound probe that we would use. It still relies on those piezoelectric crystals, and they're sending that sound, but instead of sending that sound through the cable to the machine, they actually just send the information wirelessly through the machine. So it's still the same basic ultrasound physics and those echoes converting into the images, but instead of it being done through the cord, it's just wirelessly, which is just really fascinating how much technology has changed over the past few years. Some of the benefits with the wireless transducers is that it's helping keep the sterile field. When you're using a traditional ultrasound transducer and it has that long cord on it, if you're doing procedures, you're normally having a sterile cover that's going all the way down the length of the cord. With the wireless transducers, they have smaller covers that help keep that sterile field and less that there is to manage and to keep clean. As I've talked about, the point of care ultrasounds is just a huge benefit. When you're going to scan a patient bedside, especially in the emergency room, you're moving stretchers and IV poles and other things that could be in the room. And for this, you're just having the tablet or that smaller device and the wireless transducer. That's going to save time managing equipment, and it's just going to be faster for the patient's whole experience overall and getting that answer for them, that diagnosis. Um, it scans clearly within 10 feet of the device. I think that that's a good amount of wiggle room when you're scanning. And also, you're going to reduce the costs because you're not going to be paying for that whole additional machine. There's limitations when it comes to them as well. That 10 feet of the machine, hopefully, being bedside, you would be within 10 feet. But I don't know how the connection works if you're moving around the room or just in different situations. The 10 feet could be a little bit of a limitation. The transducers also, because they run off of batteries, they can overheat. That was a negative that I was seeing, is that they are able to overheat. Every machine and every piece of technology is going to have some sort of limitations, so it's kind of just weighing your options there. The time for charging on most of these wireless transducers I saw was about 3 to 5 hours. You're not scanning for full comprehensive imaging. You're kind of, it would be like a diagnosis bedside or something that would be easily spotted, like a mass or a bleed or fluid buildup. So that's kind of a limitation as well. You would still need to come to the ultrasound department or have further imaging if you needed that comprehensive imaging, which isn't necessarily a bad thing, but just at that bedside scanning, that would be more of a downside. Another limitation is that they're easier to lose track of. If physicians are putting these in their pocket and then going from one patient to another, it is a possibility that they could be lost. This was a chart that I had found. I thought it was really interesting how it compared the traditional systems versus the wireless point of care scanning. As you go through it, you can see mobility, time setup, infection control, that patient comfort category, and then also how it's handled in an emergency response system. When it comes to the wireless transducers and the future of ultrasound, I definitely see more benefits than I do limitations. I do believe that with the wireless probes, there will be faster diagnosing with that point of care scanning and being able to have flexibility when scanning. It definitely is more accessible having the probe right at your hand and having a smaller tablet or phone. I think that this is going to benefit the whole ultrasound community as a whole. I do think that more people, healthcare professionals, will be scanning bedside, doctors and physicians and other people. And I could see that being a limitation with ultrasound technicians if we're having more providers scan bedside. There's that positive side of it with that patient getting faster care. But what does that look like for the ultrasound department as a whole? Instead of those patients coming to scan bedside in the ER or having them transported to the unit later, yes, they're still going to need comprehensive scanning, so maybe it won't affect the ultrasound community as a whole that much. But that was just something I thought about, that if we're having a lot more doctors scan bedside, what does that look for technicians in the future? The direction of this technology in the future, I have seen a few things about maybe the image quality not being as good as a typical machine. I think that that's something that would be easy to fix over time, with AI and all of the different image technology that we have. Just being able to kind of improve that. I think that as the technology comes further and the wireless transducers are out for a longer period of time, you can already see now that more and more companies are coming out with these transducers. And I think that every time someone comes out with something, they're trying to make those little tweaks. They're seeing, the questions people have. Same thing with the battery life. They're just finding a different battery life, maybe finding a better way to charge these devices. I think that that will be something easy to change over time. I think that these are going to be seen more in offices, and I do think that many medical fields will start to use this as a standard tool of care. You're going to the doctor's office, usually they have to order an ultrasound as something separately. Well, maybe now more we'll see that bedside scanning care, and then if there is something further that needs to be done, it'll be taken from there, and that's when the ultrasound technicians will come in. And it is a trade for a reason, and I do think that there is something to be said about, yes, a doctor can diagnose you at the bedside or see something that they need, but there's something about the radiologist reading them as well, and things that you might not see just in a simple 5-minute scan at bedside that you could catch in a longer exam in an actual ultrasound department. I chose this topic because I thought it was really interesting. It's definitely a new emerging healthcare tool that has come out in the past few years, and it seems like it's improving every year and becoming more popular. I have not seen this tool be used at a clinical site yet, but I actually do work at a local hospital, and I have seen them used for IV placement, which I thought was really interesting, just to have that wireless device. And the situation that I saw, they were using it on an iPad, and so to be able to help visualize the patient's veins and do that IV placement bedside, I thought that was really cool. Um, this is definitely future bedside care, like we've talked about, and so I would love to be a part of that. And I'm all about the patient having comfort and anything that we can do to help in their care experience, and definitely the convenient versus efficient. Everything that we're doing with these probes is to try to help ultrasound as a whole and help better the community and that experience that we're giving the patients. And these are my references. Thank you so much for watching.